Today's date is January 10th, 2017. We're here with Heather.
Hi.
And Heather came to me with a very interesting story. She has marked pain in her low back or her tailbone right here. And she also has pain at the base of her neck where it meets the thoracic spine at about that level. And you relate this to a fall that you had in a yoga class where you fell, hit your tailbone, and then you found out long after that you actually cracked the tailbone in two places.
Fractured it, yes.
Yes, and it just had to heal on its own because you didn't know it at the time.
Right.
And you've been in a lot of pain since. You've been to craniosacral people, chiropractors, acupuncturists. No one's been able to help you. And have you been in pain 24/7?
Yeah.
And today I evaluated you. This is your first visit here.
Yeah.
We checked for some teeth and we didn't find anything positive.
Right.
We checked for a disturbance that could be here from a C-section scar. That was negative.
Right.
But when I touched your tailbone, you were very positive.
Mm-hmm.
And you were also positive right here at C7T1.
Mm-hmm.
And we just did, with your permission, we just did an ozone treatment.
Yes.
And we did ozone to your tailbone, and we
Mhm.
did ozone to C7T1. What happened?
There's no pain. It's incredible. I could do like a back bend.
Are you
And when I came in, my neck was very tight, and I kept looking back, trying to loosen it up, but it was so tight and painful. And now I feel like I could do a back bend. It's very loose.
Are you surprised?
I'm very surprised.
Okay. I'm videoing this for purposes of posting it on YouTube. Is that okay with you?
That's fine with me.
Okay. And how does your bottom feel?
It feels relaxed. Before it felt very tight. Now
Right.
it feels relaxed and like a normal tailbone.
Okay.
So,
Very good.
Mhm.
Thank you very much.
thank you.
I also want the viewer to know that your doctors have given you drugs, including gabapentin,
Right.
and that's not controlling your discomfort, correct?
No, I mean,
Okay.
Neck.
Can you
No,
do
it's
that
not.
again? Can you do that again?
it's fine. I mean, it's
And
amazing.
what was the word you used?
Incredible?
Yeah.
It's incredible.
You show me what you can do with your leg.
I mean, it's just, I can move. Before I couldn't move. So, it's
Okay.
nice.
Great. I'm glad to hear that.
Okay.
How long will this last?
This is husband Newt, and are you surprised by what you saw?
Yes. It's amazing.
Okay, good.
But the thing is, she doesn't always tell me when her back's hurting, but I can tell that it's hurting because it affects her mood. And so I can just see her totally feel free from that yoke of oppression of pain that's been in her back.
You see that now.
I see that now. I can tell in her face. So, that's why it's almost I can't believe it.
Yeah, it's incredible.
So,
Okay.
I'd like to see how long this lasts, and I look forward to exploring it further.
Good. Thank you. And I may video you and post you too.
Fine.
Thank you. You asked about length of duration of relief.
Right, I did.
The fact that you got all better, this is now I'm talking professionally, means I got the right spot.
Right.
There is a local anesthetic in there, but it's a very short-acting local anesthetic. It wears off very, very quickly.
Mm-hmm.
In many cases, probably more than half, the pain just doesn't come back. Or if it comes back, it's much smaller because the ozone kicks in and begins healing immediately. It's reducing inflammation. That's what it does.
Okay.
So you hire me, so to speak, to get the right spot.
Mhm.
And if I did get the right spot, then we got a great result like we did on you. So I did my job. After this, it's between you and God
Mm-hmm.
for long-term or permanent results, which we hope we get because we hope that the ozone kicks in, promotes healing, gets the tissues to heal, quells the inflammation, and does well by you.
Mm-hmm.
We will know that very shortly because the local anesthetic wears off like in about 15 or 20 minutes, and we see how you do. Okay?
Okay.
All right. A yoga teacher, let's see what you just did. Didn't you just... Okay, and you say you could not do that before?
No, I couldn't.
Wow, full extension.
Full extension.
Okay.
That's good.
One